Hey everyone, welcome back to Forward Therapy. My name is Kelly Troutman. I am a certified hand therapist, and in today's video, I am going to start a 7-part series on wrist tendinitis management for therapists. So this video is intended for PTs, OTs, CHTs, people interested in hand therapy, students, and if you have wrist tendinitis, it's okay to watch this video too, but just know that this is really a video designed for the therapist's management of tendinitis and what that looks like. So again, 7-part series. We are going to start the 7-part series today with assessment and evaluation. So I think that beginning your treatment plan, any good treatment plan needs to have a really good evaluation, a really thorough assessment prior to making your plan, because every person is different, their goals are going to be different, and their needs are going to be different. So let's get into it. Okay, so let's talk about what the components of a thorough evaluation or a good assessment might be. First of all, I do think it's very helpful to get a thorough and complete history from the patient. Review any notes that you have from the patient's chart or from their doctor, if they have any imaging that's been done, past injuries or surgeries. All of those things are important to know. You also want to know kind of about the symptoms that they're having, right? So have them tell you how long it's been going on, what they're feeling. A lot of the times, when I bring the patient into the clinic, I'll have them sit down and I'll say, "Hey, I saw the note from your doctor. It looks like you've been having, some pain with your wrist. Can you tell me a little bit about what's been going on and what that feels like for you?" And that usually opens them up enough to be able to give me a good history of how it started. Was it a gradual onset, or was there an injury that occurred? Is this something that they feel a new activity or a change in activity or a work activity? Is there something that they feel triggered it? And have there been any changes in their routines or their hobbies or activities? Are they doing something different or new that could have brought this on? I do think it's also helpful to know how it's changed over time. Is it getting better? Is it getting worse? Is it just constant and unchanged? Those things are very helpful to have them described for you. And it's also nice to know exactly where their symptoms are. Do they feel it localized to the wrist? Is it something that's radiating upward or downward? Or is it very diffuse, where they can't really pinpoint an area? Or is it very local? They can pinpoint an exact spot. Those things are going to be really helpful history in terms of, what we need to know. I also like to ask about their daily routines, right? What are their ADL and IDL activities that they're having difficulty with, aggravating factors, things that make the pain feel better potentially. I like to know what your occupations are, what your hobbies are. Do you play music? Do you do sports? What exercise routines are you in? All of those things are very helpful to get a nice rounded history. Typically, after getting a history, I will start to ask some questions about pain. Where are they feeling the pain? What is the intensity like? Is it constant? Is it intermittent? Does it happen certain times of the day? Or is it more activity dependent? Or are they noticing it even at rest? I like to, I know there's a lot of different pain scales that you can use. I don't typically get a pain number from people, but I just have them kind of describe it to me. I think it's great to get a pain number or something, more objective, in terms of something you can look at over the future in the course of their treatment. But I find that the pain numbers can be really difficult for people to put an exact number on. And sometimes that, it kind of trips them up. So I've been more focused on kind of tell me about what the pain feels like. Is it dull, achy, throbby? Is it radiating, burning? Usually they'll tell you, and those words are going to tell you how to treat what they have going on. So it's really helpful to just let them talk, let them tell you what's been going on, what aggravates it, what makes it feel better. I always like to ask them, what have you tried? Because sometimes they're going to say, I haven't tried anything. And sometimes they're going to say, I've tried acupuncture, massage, medicine, ice, heat, blah, 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 all these different things. So it's good to know where they're starting from to help you tailor what information you give to them and what will be most helpful for them. So definitely assess the pain, see if they can localize it, if they can point to one spot, or if it's very diffuse. Those might tell you different things. So it's really helpful to get that pain description, the intensity, where it is, and kind of what bothers them. Kind of bundled back to back with pain, I like to ask some special questions. So I like to always know, are you experiencing a numbness or tingling that could indicate, nerve symptoms are going on? Are you noticing anything like clicking or popping that wasn't there before, or clicking that's painful? If it's not a painful click, most likely it's not something to be concerned about. If there's a shift or a clunk, that's a totally different story. But a lot of times we just have kind of little areas of the joints that will kind of release air from the joint, and it's not really a harmful thing or something that they need to worry about, but it's good to notice what they're noticing. I also like to ask, are there any feelings of giving way? Do you feel really unstable? Any clunking or shifting or things like that you've noticed? Because that'll give you some ideas. Like maybe they've noticed their ECU snapping, and they don't know what that is, or they've noticed, like an SL ligament, and they move the wrist and it kind of clunks to catch up. So those things will give you a good idea, again, to narrow your focus. Another thing to look at in your wrist evaluation or assessment is look at their posture. How do they walk when they're coming into the clinic? How do they sit when they're in your clinic chair? Are they, forward head posture, kyphotic curve? Are their shoulders rounding over? Are they leaning to one side or another? How do they posture? How do they look? Are they guarded with the extremity where they kind of hand it to you like a little wounded bird? Or are they like pretty much holding their bag or carrying things with it and not guarding? All of those things are so helpful to know and to notice. And especially because our distal extremity is so controlled by our posture, our scapula, all of those scapular stabilizers. So if we are not in proper alignment, we're going to have a lot of distal compensatory movement. So it's important to see what they look like, to ask them about their posture, on a daily basis. Is that something that they work on or have noticed, or something that they feel needs to improve? I also like to do a cervical screen and just check out what their shoulder is doing and see if there's any funky things going on there. So with the cervical screen, I'll usually just start with having them do cervical rotation, side to side, see if that increases the symptoms, cervical side bending, and it helps you see if they have tightness one direction or tension or something just looks a little wonky. I also like to have my patients just do a general shoulder range of motion screen. So I'll have them bring their arms up into flexion, touch the back of their head, touch the small of their back, so you can see external and internal rotation. Just see what things look like. If you need to step behind them and look at their scapular motion, that's fine too. It just helps you to kind of figure out, okay, is this something where maybe this injury has happened because they have some sort of scapular dyskinesis or some other issue? So those things are also really important to look at, even though we are hand therapists, right? The whole chain is involved, so it's really good to look at. At this point in the evaluation, I've got some pretty good basic information about them. I'm going to start diving into the actual extremity itself and the actual body part, the wrist itself. Typically, I like to start with active range of motion because the palpation, the special testing, the provocative things that you're going to do, and even passive range of motion is probably going to bring on their pain. So it's good to do active range of motion first before their pain gets exacerbated, and then you can't really get good information about how they actually move. So I'll typically just have them do supination, pronation, wrist flexion, extension, ulnar and radial deviation. I'll have them do finger movements, check if there's any like nerve type symptoms. Obviously, you would check, your nerve special tests and things like that they can and can't do. But I just want to see how they're moving, if there's anything that hurts them actively, or if it's more just with load. Those things are really helpful to notice. And then after I've tested their active range of motion, I will start in on kind of my palpation, my special testing. So something that I actually learned from MedBridge, which is cool, from one of the courses that I took from them online, is to look at the BLT, bone, ligament, tendon. So it just helps you to kind of remind yourself, okay, this is what I'm looking at, and make sure I've got all of these little systems. So BLT. So I typically start with the bone and ligament kind of stuff. So I'll do things like the, Druge allotment. I'll do LT, SL allotment, just kind of checking out to see how the joints move and always comparing to the contralateral side and seeing, again, if they have pain or any symptoms. I'm also looking for laxity or lack of mobility compared to the contralateral side. If all of that kind of clears, then I'll usually go into more like ligament special testing. So if they have ulnar-sided pain, obviously I'm trying to look towards TFC or LT ligament. If their pain is more on the volar or radial side, or actually it's usually dorsal radial side, not volar. I don't know why I said volar. A lot of times it could be SL ligament, so that's an important ligament to test. You have some special tests there. You want to kind of have those little clinical tests in your pocket, and at least a few, maybe one or two for each. And then typically I'll go into my tendon testing, and these I think are really helpful. I'm going to demonstrate them on myself, which obviously is not how you would do it in the clinic. But if you can do resistance tests of each motion, and then you can also do stretch tests of each motion, it's going to tell you some information about, okay, yeah, maybe if they can't resist the motion that I'm testing, it's very painful in that tendinous area, probably looking at kind of a tendinopathy, like a tendinitis. If it is more painful, more on the stretch of that tendon or muscle, then it might actually be a tenosynovitis. So for the resistive testing, obviously when you're testing this on the patient, you would have them, with their arm extended. For wrist extension, you're going to test them in a loose fist, elbow extended, forearm prone. You're going to resist. They're going to try and push up against you, so you're resisting that wrist extension. If they say, ow, ow, that's painful here or here, it gives you kind of a good idea. You want to do the ECRL and B and separately ECU, right? So you're going to resist kind of at an angle for ECRL and B and at an angle for ECU, okay? For the stretch tests, same thing. You're just going, again, this would be like an ECU stretch test, right? Because you're going into the opposite direction, flexion and radial deviation. And then for ECRL and B, you're going into kind of a flexion with a slight ulnar deviation. Okay, so those are going to be your wrist extension or extensor tests, I should say. If you're positive, in the extension test resistance, that's probably more indicative of a tendinopathy. If they are positive more with the passive flexion, it's probably more of a tenosynovitis. So you're going to look kind of more up at the extensor retinaculum. Same thing for the flexor tests, right? You're going to have them palm up, elbow extended. This time the fingers can be extended. And then you're going to test, again, FCU. You would resist kind of the flexion pushing towards radial deviation, right? And have them resist. FCR is going to be the opposite direction, right? So you're pushing kind of towards extension and ulnar deviation so that they can resist you. The stretch tests for these, one note for FCU, no tendon sheath there, right? So if they have a positive stretch test, there's no tendon sheath here. That's not indicative of tenosynovitis. It might be something else going on, like possibly a pisotriquetral arthritis or something else that you need to look at. But the other direction is indicative of FCR, tenosynovitis. So hopefully that makes sense. I know that's a lot of information. Just to wrap up, extension resistance testing is going to test for the tendons of the extensor muscles. Flexion resistive testing is going to test for the tendons of the flexor muscles. And then the stretch tests, if you're stretching the wrist extensors, you're testing for tenosynovitis of the wrist extensor muscles. If you're testing in a position of wrist extension, so you're stretching the wrist flexors, that means that there could be a tenosynovitis of the wrist flexor tendons. So I know that was a lot of information. That is just kind of my general process when I'm doing a evaluation and assessment for a patient that's coming in with a diagnosis of wrist tendinitis or wrist pain, wrist sprain, some of these like general diagnoses that it might be helpful to kind of narrow down and things that you can test for. So that's typically what I'll do for my evaluation. If you have other tests that you tend to run or other steps of your process, let me know in the comments below, because I'm always looking to improve my process. I've been practicing for 6.5 years, but there's always new things to learn. And my assessment skills were like really not very strong as a new grad. I do feel like I've gotten better at it the last couple of years, being in a bigger health system, a hospital-based system. But please let me know if I'm missing anything, and I'll see you in the next one. Remember, this is a 7-part series. Our next 6 videos after this are going to focus on general principles of treatment. They're going to talk about different ideas for treatment of wrist tendinitis for therapists. Thanks so much for watching, and I'll see you in the next one.